All right. I believe we have a very full session today, so I will start by doing a couple of housekeeping pieces. So welcome and thank you for attending today's session, Family First Prevention Services Act update. A quick moment for housekeeping. All participants are on mute. For STC purposes, participating via a group is not permitted. Please log in individually to receive STC credit for attendance. You are welcome to use the Q&A box throughout the session. CCR staff and or presenters will be monitoring and responding verbally or via the box directly. STC information will be sent out the week after the conference upon verification of attendees present. STC credit will be given to all attendees logged into the session. CPOC is tracking via the attendance email logged into the session, so no need to check in or type your name. All sessions are being recorded. However, the chat and QA features will not be captured in the recording. At the end of the conference, you will receive an email with the evaluation link. Please be sure to complete it by next Friday, June 18th. And now I hand it over to Chief Jennifer Branning for introductions.
Good morning, everyone, and welcome. I'm Jennifer Branning, Chief Probation Officer with the Lassen County Probation Department. I am also the Secretary Treasurer for the Association and the Chair for our Juvenile Services Committee. I want to thank you for joining us at CPOC's 5th Annual CCR Conference. We hope you enjoyed yesterday's kickoff of the event and all of the amazing sessions. We had Fostering Hope from the general session, which ended up diving more in depth in a standalone breakout session that included an example of how hope can be implemented even in your own department. And hope is such a powerful word, such a powerful feeling, and one that everybody can share. There was also a session on home-based care. If you missed it, you'll be able to see those recorded webinars after the conference. Yesterday's sessions are a perfect segue to what we begin today's general session with, which is the Families First Prevention Services Act, also known as FFPSA. As you may know, when we remove children from their home and place them into foster care, sometimes we put them in an unknown world, and that's a little daunting and a little traumatizing at times. The federal act was created to look at families first, which keeps youth safely at home whenever possible, to prevent traumatic experiences of youth entering into foster care and providing more family-based services. Additionally, it focuses on enhancing the well-being of youth currently in the foster care system. These are all very important elements that will help continue the work that we have been doing since the development of the Continuum of Care reform. I am pleased to introduce to you today Kelly Winston, Bureau Chief, Child Welfare Policy Program and Development with CDSS, Lisa Witchey, Bureau Chief for the Integrated Practices and Resource Development Bureau, Alicia Bernstein, the Manager, Provider Policy Unit with CDSS. They will be providing a high-level overview of the planning efforts being done in California for this October's implementation of FFPSA. Additionally, I'd like to introduce you to Peter Watson, the Senior Director, Technical Assistance Unit with the KC Family Programs. He'll begin by providing an overview of FFPSA and also discuss where other states are at in their planning efforts. So please take it away, Mr. Watson.
Thank you, Chief Branning. I appreciate the introduction, and thank you everybody for inviting me to attend the conference. I'm really looking forward to the conversation today. So we're pulling up the slides now. I'm gonna share some thoughts with you for, 10 or 15 minutes to try to give you a more of a national perspective, as the Chief said, about what's going on with Family First. We can go to the next slide, Jillian. My goal is to just give you a summary of the act for those of you who might be still trying to put it together, although I won't spend a lot of time on that. Think through or share the way that we at KC Family Programs think about Family First as part of a broader transformation effort in child welfare, and I'd include juvenile justice with that as well, and then give you a sense of the progress out there that states are making on implementing their Family First work. So I also want to say, by way of background, that at KC Family Programs for the past 2 years, we have been facilitating a national learning collaborative on Family First. So we have representatives from all 50 states, multiple counties, who've been coming together for 2 years, twice a month, to talk through where they are in their Family First implementation work, and I've been facilitating that effort, so that's where I'm drawing most of my information from today. And I welcome questions throughout, so let's just move forward. So next slide, please. So just by way of background, in thinking about Family First and where it came from, the legislation that we'll get into in a minute really reflects, I think, the involvement of hundreds of people legislatively, including, I think really importantly, people with lived expertise, both parents and young people in particular who were or had been in the child welfare system or the juvenile justice system, had a big impact on the way people on Capitol Hill and others thought about the needs out there, and had a big impact on this legislation. So a couple things about that I think are background to the Family First legislation around what we know is best for children and families. We know that the goal of child welfare should be to ensure safety, permanency, and well-being of children. We've been saying that for a long time. I think Family First, it seems like an obvious thing to say, but extends that to children and their families. We also know that intervening as early as possible supports child well-being. That underlies a lot of the effort here in the legislation and what we're trying to do with implementation. We know that removing children from their families and homes creates distress and trauma. And given that we try to avoid trauma whenever possible, this legislation is looking at trying to balance that a little bit and try and prevent those removals, particularly when we look at the fact that we know there are children who can be better served remaining safely in their homes and having their parents and those children receive community services, support they need while they are in their homes. And that really underlies a lot of what came to be in Family First. So next slide, please. So the Family First Prevention Services Act was passed in 2018 as part of a bipartisan budget act. It was a little bit of a surprise, actually, to a lot of folks that it had been passed and then it had been passed in Congress, but not finalized. And so I think a lot of folks thought maybe it wasn't going to happen. And then all of a sudden it came through in 2018, which was exciting. It's one of the biggest changes we've had in child welfare in a number of decades, I would say. But at its heart, there's a new option for states and tribes to claim Title IV funds for prevention activities. As you know, we're now in 2021, but that could have begun as early as October 2019. And I just lost my video, so I'm going to keep talking. Hold on just a second here. Excuse me. Trying to get my screen back so I can make sure I can see you. Can somebody text me and let me know whether you can still hear me?
I can hear you,
Peter.
Peter.
Okay, good. Let me get this back up there on the screen then. Sorry about that. Not sure what happened. There we go. In addition to now allowing states to use claim Title E funds for prevention, which is a major change, the other part of the legislation that we'll talk about today is there's a new policy to ensure appropriate placements for children in foster care and the qualified residential treatment programs, which we'll talk about in a bit. And then there are other parts of the legislation, which I don't think we're going to get into in detail today, but that focus on court funding, different types of prevention, specific substance abuse funding as well. So let's go to the next slide. So just to compare and contrast a little bit what we had before the Family First, it used to be that most federal dollars, particularly 4E, were focused on foster care, meaning states could access them only when children were placed. This new legislation allows us to access those dollars for prevention. It used to be services were only for the child. Now we can access these prevention dollars for parents, children, kinship caregivers. It's an open entitlement. There's no income test as compared to what 4E used to be. The money for children placed in group homes used to be provided with little oversight Now there really is an intention to ensure that children are in family-like settings whenever possible, and when they are in group homes or group settings, that they're appropriate for the needs of those children. And again, we'll get into what that's going to look like in California going forward. And there's also an ability here to have parents placed in residential treatment with their children and access federal funding for those placements. So that's some examples of the opportunities that everybody is trying to explore through Family First. So next slide. I think I've already talked about the top. Let's talk about who this is focused on. So the prevention services funding, as I said, is an open-ended entitlement, which is new. And the candidates for foster care, you'll hear us talk about this, are children at imminent risk of placement in foster care. And we'll get into that a little bit more later, but each state has to define imminent risk. The Children's Bureau in the Department of Health and Human Services was very clear early on that it and the federal government were not going to define imminent risk. Each state was going to have to do that based on how they wanted to use Family First. Other candidates for foster care that you can use prevention services for are pregnant and parenting youth in foster care, also parents and kinship caregivers of the young people and children that are being served. So next slide. The prevention services are eligible for up to 12 months of federal reimbursement. They talk about 3 broad areas in the legislation: substance abuse prevention, mental health services, in-home parenting skills. There's no limit on how many times a child, parent, kin caregiver is eligible, and that 12 months can be extended. And all states, I think, are doing that, where you can add on additional 12 months if necessary for the children who are being served. Next slide. Those services in those 3 areas have to be evidence-based and trauma-informed. I don't think we're going to get into the details of how that's happening, but there is a federally funded clearinghouse that is rating different evidence-based programs as well-supported, supported, or promising, and states have to have a mix of those in terms of providing services. In-home services are broadly defined, so that doesn't necessarily refer to the location where services are provided, just to be clear there. Next slide. So the other part of the legislation that we'll talk about, you'll hear us refer to this, I think, as Part 4 at times. Part 1 is prevention, Part 4 is ensuring appropriate placements. But beginning in October 1st of this year, there's a requirement on what foster care placements can receive federal reimbursement. And again, as I said earlier, the goal was clearly to encourage placement in family settings whenever possible. And another goal was to address concerns about an over-reliance on congregate care in a number of states and jurisdictions across the country. And that was where the creation of qualified residential treatment programs, QRTPs, came from, and the requirements that fall under those. So next slide. These are the types of placement options that are already allowable under 4E, and these will continue under Family First. I don't think I need to go through all these, but you can. These should be fairly familiar to everybody. So let's just go to the next slide. And then the other option is the Qualified Residential Treatment Program. So just a couple things about this. The QRTPs have to have a trauma-informed treatment model, have to have registered or licensed nursing and other licensed clinical staff on site or available 24 hours a day. And they have to be consistent with the QRTP's treatment model. The idea is that these also focus on outreach to and engagement with a child's family as part of the child's treatment plan, that we can't just focus only on the child. As what I said earlier, expanding that focus to the child's family. There is a requirement of discharge planning, family-based aftercare supports that have to last for at least 6 months. And each state has to license QRTPs and make sure that they are accredited. So there's a number of review processes in place that we will get into in terms of how California is going to handle that when Lisa Witchey talks a little bit later. So next slide. So again, that was really a quick overview of some of the two major aspects of the legislation. But I wanted to think with you a little bit and share with you the way that we at Casey Family Programs and really other states across the country, as we've all worked together for the last 2 years, think about the potential of Family First. At Casey Family Programs, and again, the states that have been involved in doing this planning, we've really tried to make sure together as a group that we remind each other how important it is to think about Family First in a broader context. And that is, what is our vision for how we want to serve children and families in the future? What is it that we want to accomplish in our systems where we work with children and families? And the key, I think, in thinking about this and in engaging successfully in an effort to implement Family First is to think about it not from a technical standpoint around what's required in the new legislation and just try to tick off all the boxes and meet federal requirements. It's how can Family First be one tool in your toolbox for transformation? Where do you want to go? How do you want to serve children and families? What is your vision for broader prevention around making sure that children and families are not coming into the child welfare system? And as the chief said earlier, it sounds like yesterday there was some conversation about hope. We at Casey Family Programs, and I think a number of states, really look at the Family First legislation as giving everyone much more of an ability to operationalize hope in the way that we think about it. Hope that we can serve, engage with authentically, work with communities in a different way to make sure that families and children get what they need in their homes, in their communities, without having to come into the child welfare system or really be engaged with the child welfare system. Now, I'm saying that I know that Family First, what we talked about earlier, focuses on children and families at imminent risk of placement into the child welfare system. But states have gone at that in a number of different ways, and we can get into some of those details a little bit later. So can we go to the next slide? Just another visual, but to think about what is your high level vision. And this is what we've said to everybody. And I challenge the audience here, who I know isn't necessarily first and foremost a traditional child welfare audience, but what's your vision for how you want to work with young people and their families? And how can you and California use this legislation to help you get there? That's the ongoing challenge, I think, that we talk about and states talk about all the time. So whenever states come into our learning collaborative and share with each other, they almost always start with where they're trying to get to in terms of their vision for prevention, and then how this can help them get there. Yes, we have plenty of conversations about the technical details because it's complicated and it's going to take a while to get to where we need to get to, but we really don't want to ever lose sight of the vision and where we're all trying to get to. So let's go to the next slide, and I'll give you some updates on where people are, where different states are. So I wish this were a little bit larger, but this gives you a sense of where states are around, let me just be clear about this, around their Family First prevention plan. So these are states that have submitted to the federal government or not their prevention plan for providing prevention services. The way the legislation works, you can't start claiming for those services until you also have an approved approach for your QRTP effort. So when you look at this map, the states that are green are the states that have approved plans. And in order to have an approved plan, you also have to have your QRTP effort in order. The states that are orange have submitted prevention plans. And then the states that are blue are planning to submit their plans this year to meet that October 1st deadline. And then the states that are brown, really, I'm not trying to say Texas doesn't intend to submit a plan. We're just not exactly sure what their target is. So that's why we left those brown. So that's more a reflection of what we know or don't know at Casey. I also want to draw your attention to the fact that there is one, well, actually, let me go to the next slide and you'll see it easily, but there are 3 tribes that have submitted as well. So these are the states that have approved Family First prevention plans. You can see 12 states: Arkansas, DC, Iowa, Kansas, Kentucky, Maryland, North Dakota, Nebraska, Oregon, Utah, Washington State, and West Virginia. And then the Eastern Band of Cherokee Indians also has an approved prevention plan. Then if you go to the next slide, it'll show you the states that have submitted. So these states have submitted plans. The process works so that you submit plans and there's typically a resubmission and going back and forth. But there are 12 states right now: Alaska, Colorado, Hawaii, Illinois, Maine, Missouri, Montana, Ohio, South Carolina, Tennessee, and Virginia, and then 2 tribes, the Aleut community of St. Paul Island in Alaska and the Salt River Pima Maricopa Indian community in Arizona. So you all are in California. What do you notice? If you go, can you go to the slide before this, Jillian? Forgot to mention this. So the states that have approved plans, there we go. One of the things you'll notice there is there are no state supervised county administered states that have an approved plan right now. But if you then go to the next slide, Jillian, in the 14, there are 3 county-based states that have submitted: Colorado, Ohio, and Virginia. So we do have a sense of the way that they are approaching this, and some of the other larger states would have lessons as well. But I just wanted to point that out to all of you. And then I think that is my last slide, right? So the only other thing I wanted to say, and I think we'll get into this later, and it goes to the idea about the vision, and I think you'll hear Kelly talk about this as well. But it's not, so yes, states are submitting a 5-year prevention plan, but I tend to think of it as they're submitting their first 5-year prevention plan. And of those states that are approved, several have already submitted amendments to their plan. Either they've added new services, they've thought about changing their definition of candidacy. This really is, I know we use the language a lot, but it is a living document, it's a living plan. So it's fine for states to make a decision to start somewhere and then build out their family first prevention approach as they go forward. The federal government has encouraged that. I think my understanding is the amendment process is relatively straightforward. It's not a bunch of hoops to jump through. So it really is something that I think is going to change over time as we learn more and more. As states use, for instance, certain types of services and start finding success, other states might then choose to use those same services, amend their plan, and work together. So this is really going to be an ongoing piece of work around the way that we think about our prevention services and the work that we're doing. And we will all across the country continue to work together and expand the way that we're doing this. So I think those are the major things I wanted to cover. So Stephanie, are there any questions that you want me to address now, or do we want to move on? I'll leave it up to you. I know you've been monitoring.
Yes, thanks, Peter. We do have a couple questions that came in. The first question was, reading this, it sounds like the QRTP is responsible for providing the aftercare for 6 months. Is that correct?
Not necessarily. I think that can be built into QRTPs, but states can take that on in other ways. They can also provide aftercare services. It doesn't necessarily have to come through the QRTP provider. And again, I think Lisa and Alicia will cover that in terms of the plan for California. But so I think there's some variation out there in the way states are doing that.
Great, thank you, Peter. And then the other question we have is, does each state have a federal funding cap for prevention dollars?
It's an open-ended entitlement. So no, there is no cap on the dollars you can claim through the prevention part of Family First. And that's what's one of the exciting parts about this legislation for all of us in terms of thinking about child welfare and what it's been in the past.
Great, thank you, Peter. I think that's the only questions that we have at this time. Everyone, if additional questions come up or you're thinking of something, we hopefully will have well, it looks like one just came in, Peter. Is the state funding going to be divided up between the counties?
That's an easy one for me to answer. I don't know. And again, that's going to vary from state to state in terms of the way they do it. So I think we'll hear more about the California plan as we go forward. So, but it's up to each state to figure out how to work that. Kelly and Lisa aren't going like this now because I just said something wrong, but I think I'll let them handle that question.
Great. Thanks, Peter. Thanks, Peter. We can go ahead and move on to the next section. And once again, if any additional questions come up, if there's enough time, we'll go ahead and answer those questions at that time. And once again, there's going to be coffee and conversation sessions. If you were not able to get your questions in, you can do that. There'll be part 4 today and then part 1 tomorrow. So you can ask those questions at that time if we're not able to answer those. All right, we'll go ahead and pass it over to Kelly Winston.
Thank you. Good morning, everybody. So I'll go ahead and just say quickly for the question that was just posed to Peter, we haven't gotten to the point where we're thinking about methodology for allocation just yet, but I'm sure that that's something that we'll be talking about, and there will be a county level allocation. So that's an easy question to answer. We'll just have to talk much later about what that looks like in implementation. So again, I'm Kelly Winston. I'm Chief of the Child Welfare Policy and Program Development Bureau at CDSS. And for the most part, we focus on activities around the entry into the child welfare system. And so for today's presentation, the focus is on early intervention activities, and that would be the 5-year state prevention plan. So I'm going to talk about the development of that process and how we're working through it. I will start with just a brief caveat. While we focus on the prevention plan, many of you may have seen the March version of the plan that was out for public comment. And we heard a lot of feedback on that, and we're actively working on the next iteration of that. We had anticipated that it would be out in May, but we're having a little bit of a delay because of some of the activities happening at the end of the fiscal year and getting that next iteration of the plan through our control agencies. So more to come on that in the near future. So Jill, do you want to go to the next slide? Great. So like Peter said, FFPSA is a slice of prevention, but for the 5-year prevention plan in California, we really wanted to align our efforts with other types of prevention strategies that are happening in California. So while our entire approach to prevention really does include primary and secondary, funded by other efforts, FFPSA really focuses on our tertiary strategies. We'll talk a little bit how we're trying to align those, but I just like to make that clear from the very beginning because the funding for FFPSA really doesn't cover those real basic primary and early intervention activities for families at risk, but who have not yet come to the attention of the child welfare system. Next slide, Jill. So again, due to the narrow focus of FFPSA, only those children at imminent risk of foster care, so in other words, tertiary prevention, and only those services that are approved by the Federal Prevention Services Clearinghouse can be included in the 5-year prevention plan. So funding really can't cover that full range of services that we need to support the entire prevention vision. Nevertheless, as Peter said, FFPSA is the first legislative action that permits the use of 4E funding for prevention. So we're excited about that, and we really want to make sure that we use that to the maximum extent possible. It really does give us the opportunity to have families, particularly parents, receive services. Again, we're going to try to do our best to align our FFPSA approach to the other activities that we have for our prevention vision. We have a partnership with the Office of Child Abuse Prevention. So while my bureau has been the lead in developing this prevention plan, we have worked hand in hand closely with our partners over in OCAP. And so this will be a great opportunity for us to kind of push those two approaches together. So even though FFPSA doesn't quite get to that larger prevention vision on its own, we want to make sure that we use FFPSA to complement the additional structures by building capacity of services, particularly those evidence-based practices that are included in the clearinghouse, and by building and implementing processes for monitoring fidelity of use of those programs, and then conducting evaluations for promising and supported programs, and doing that within the framework of a continuous quality improvement approach. We also want to make sure that we allow for the use of data and lessons learned from year one of our implementation of the plan to build upon that improved system moving forward. So starting somewhat small and then moving larger over time. Next slides, Jill. So our approach in California really is to do this in two ways. So many of you have seen our trailer bill language. This is the way that we're trying to legislatively enact FFPSA. So we're introducing language to codify the federal law into state law. This really gives us the opportunity to opt into the prevention services program, set those broad requirements and definitions into statute. And then additionally, we want to get our state plan submitted to the Administration of Children and Families. So through the state plan, we'll take those broad authorizations in the legislation and identify more specifics around how we intend to opt into FFPSA. And so further detail in the plan will be provided to the federal government about how the program will be operated in California, including more specifics about who will be served, the specific services that we hope to include in our prevention plan, and then also how California will meet all of those federal requirements, such as reporting, evaluation, and monitoring of fidelity. And through future implementation conversations, we'll be hammering out those details, and there will be lots of opportunity for stakeholder engagement while we develop additional departmental guidance. Both of these activities are in process as we speak, and so those of you who have participated and given comment to either our trailer bill language or the state prevention plan, that's been very appreciative, or we're very appreciative of that, and it's helped us to develop a better plan as we move along. Next slide, please. Okay, so in the March draft of the 5-year prevention plan, we talked about initial eligibility in California. This is a bit more of our narrow approach because we really wanted to focus on those children that are known to be at imminent risk of foster care. So that was somewhat limiting for us. So while our trailer bill language really does mirror the federal law, and it just uses that basic terminology of imminent risk. In the plan, we further defined the families that we intended to serve as children and families who are receiving voluntary or court-ordered family maintenance, probation youth deemed as being at imminent risk of foster care using the tool that you're all familiar with, and then children whose guardianship or adoption arrangements is at risk of disruption, family reunification service recipients with trial home visits, and then tribal children identified by their tribe as needing prevention services. So again, in the March version of the plan, the intention was to start with these populations and reassess after a year to determine how the populations should be expanded. And we actually built into Trailer Bill a requirement for us to do an annual reassessment for the first 3 years. So that's the proposal on the table now that gives us that ability to do some of those amendments that Peter referenced a little bit earlier. And then, in our stakeholder feedback, we heard a lot about the question of candidacy and who would be included. And so we're taking that stakeholder feedback and really using that to help develop the next version of the plan. So we should see some changes pretty quickly. Next slide. Okay, so again, in the March, well, actually, I'll start with Trailer Bill. So in Trailer Bill language, it really just provides some definitions around what prevention services are. It's really those services described under federal law, rated as well supported, or promising in the federal clearinghouse. In addition to those programs, there is the ability to have approved adaptations or eligible adaptations in order to have programs that increase the ability to have cultural relevancy of a program. So if an EBP doesn't quite meet the needs of, say, like your tribal youth or other communities of color, they can have small shifts or changes to them in order to better serve the population that we want to see engaged in services. So those are good things to keep in mind as you're thinking about EBPs. And while we don't talk about specific EBPs and trailer bill, we don't want to box ourselves in over time. The state plan will have more information on what will be included. And in the March version of the state plan, we identified for the first year a couple of EBPs, so functional family therapy, healthy families in Tribes America, and motivational interviewing. And then additionally, we identified that there were some programs pending that we would include if they were able to be rated in the clearinghouse. So I think that was wraparound and trauma-focused CBT. And then we hope to partner, I might have that one wrong actually, but we hope to partner with the University of Chicago to help develop additional programs that can be raised up and included in the clearinghouse. And so in the March version of the plan, those are the programs that have been identified. Again, in stakeholder feedback sessions, we heard a lot of requests to expand those. And so we're taking that into consideration for the next I just described is what's in the current plan, but may actually change in the next iteration. Next slide, please. Okay, so I've talked a little bit about stakeholder engagement, and I just wanted to highlight here some of the opportunities folks have had to give us information about what they wanted to see in the state plan. So in February, some of you may have attended and participated in a very widely attended summit where we first started talking about, what is this whole FFPSA prevention plan and how can we implement it here in California. Subsequent to that, we submitted our March plan for review. We held over 25 stakeholder meetings to get feedback from a variety of groups and folks, including, our county and probation partners, folks with lived experience. We've had many consultation sessions with tribes. We've had lots of stakeholder feedback on TBL as well. So we feel like we got a really robust response when it came to getting us information on the plan. Next slide, please. Okay, well, we heard a lot of really great feedback, a lot of differing viewpoints, but here are some of the common themes. So one of the things that we heard was that there was an interest in us clarifying the vision of FFPSA and how that will be wrapped into the larger prevention vision. We heard a lot about making sure that we connect the concept of how we want to focus on disproportionality and reducing those communities' entry into foster care. And connecting that to the actual EBPs and candidacy populations so that we're actually doing what we say we want to do. Again, heard lots about broadening candidacy and increasing the number of EBPs. And then we also heard that there was definitely an interest in adding a community pathway so that the child welfare and probation agencies aren't the only ones serving these, that they can be served in a more natural environment by participating in programs that already exist in their community. And then from tribes, we heard loud and clear that there was an interest in applying the Indian Child Welfare Act standards for children who are eligible under ICWA, and ensuring that active efforts met, or that our prevention services supported active efforts in ensuring that there's no breakup of the Indian family. And then sorry, Jill, next slide. And then I thought I'd share a little bit of good news. So when we first put out the March plan, there was no funding identified in the January budget. But since then, in May revise, we received a preliminary approval for a general fund block grant, which is a total of $122 million over 3 years. And this is intended to support counties and local 4E agencies for implementing the 5-year prevention plan at the local level. So there's potentially some funding there depending on what happens in our budget conversations over the next couple of weeks. So keep your eye out for that, and hopefully we'll know more in the coming weeks. Next slide. Okay, and then just before I hand it over to others, a little bit more information about kind of our prevention plan timeline. So you can see a number of activities that we've already completed during February and April. May and June was intended to publish the second draft. We're a little bit behind now, but we're hoping to have that next draft of the plan submitted in hopefully the next week. So that folks can take a look at that. And then we're also entering in a formal tribal consultation process that will happen simultaneous to other executive and administrative reviews, with the goal to submit our completed plan to ACF by the end of July. And then after that's submitted and approved, we can begin all sorts of implementation planning activities, where we'll have lots of other stakeholder events so that we can start to talk about what implementation supports are needed and what type of guidance the department needs to help support those activities. Okay, that was a lot in a very short time. I wanted to help us stay on time, but I'll pause and see if we have any questions, if folks can share those.
Yes, Kelly, we actually have a couple questions that came in. The first one says, a number of STRTPs have treatment approaches that have some basis in an evidence-based practice, but they have modified the program. Would this not be allowed? How would this be evaluated?
Well, there's a couple of responses I have to that question. So these services are intended to be prevention services. So they're not likely to be happening in an STRTP because you can't have a candidate for foster care also be in foster care. So unless the STRTP is also providing prevention services, it likely wouldn't qualify for the prevention program. And then the government, or the federal government, does have some pretty strict requirements about what model fidelity looks like. There's standards for getting into the clearinghouse as a well-supported activity, has some particular criteria that the program has to meet. And then the states are responsible for ensuring that we meet that model fidelity standard. So it's a pretty high standard.
Thanks, Kelly. The other, I think this is more of a comment. It says, I hope that in broadening candidacy, we remember that if a youth is on probation, they are at imminent risk. In the past, some of our youth case plans have been disallowed by CDSS because of who the youth resides with.
Yeah, I think, when we start talking more about implementation, I think we can clarify what those assessment processes look like. And I think that should help to make those processes more clear and identify who should be served.
And another question came in, what will implementation training look like? What has already been talked about to make sure the counties understand these new guidelines?
We're not quite as far down the road in developing those training processes. Once the plan is submitted to ACF, we're really going to start launching those conversations about how we can support training. We have identified some funding that we're holding back from a federal grant, the Family First Transition grant, that will help support some of those activities. We are thinking right now that we would utilize existing structures, but as we start to put those, scope of work for contracts together, certainly we can have some conversations with you all about what that can look like and what your needs are.
Thanks, Kelly. It looks like those are the only questions that we have right now. And once again, if any questions come to mind, we do have the coffee and conversation that will be taking place tomorrow at 11 a.m. And actually one more, we'll take one more question and then we'll go ahead and move on to the next and open it up at the end if we have time. It says, can you speak more to what the clearinghouse is and how we have to use it?
So the clearinghouse really has, gosh, this is probably a better question for Peter. So Peter, chime in if you think you can answer better. But the clearinghouse really has some standards for evaluation. And so as long as the program meets those standards, then it can be included either in the promising, supported, or well supported category. And the way that we have to use that is if it's in one of those categories, we are authorized to include it in our plan, but we as a state have to identify what will be included. Any more you want to add to that, Peter?
No, just to be upfront, I think people are a little frustrated with the federal clearinghouse. It's moved pretty slowly at reviewing programs. You know, you all are from California, so the California Evidence-Based Clearinghouse, I think there are some out there who'd say, why aren't we just using that? It's been operating for years, but the decision was made not to use that. So, and you know, the whole intent of Family First is to have evidence-based programs, but I think, again, we all know that there aren't enough of them out there. And then you get into issues around targeted programs that are going to have an impact on folks from, you know, different backgrounds, different cultures. But that's where we are as a field in terms of not having that evidence in place. So it's a little bit of a waiting game, waiting for that clearinghouse to catch up and review more and more programs. The only other thing, Kelly, is that I'm not sure if people caught it, but states have to provide at least 50% of the programs they claim for reimbursement have to be at the highest level, well-supported programs. So you're trying to figure out the mix, which again, I'm assuming for California is a challenge with how big you are. But so, and just one last thing, that question earlier, I know wasn't about this, but that whole issue of modifying programs, there really is very little room for a state to say, we're using something that's well-supported, but we've modified it to fit our population, or that just doesn't fly. You've got to use it the way it's been designed and the way it's been evaluated to show the results that they rated it based upon. So I might be going too far, Kelly, but hopefully that helps a little.
Perfect. Thank you.
Great, thanks. Thank you, Kelly, so much for presenting on part one. Our next part will be, actually it's going to be part 4. We have Lisa Witchey and also Alicia Bernstein from Department of Social Services that will be presenting on that part.
Hi, good morning. My name is Alicia Bernstein. I am the manager of the provider policy unit within the new system of care branch for CDSS. And as Peter had said, part 4 really does seek to limit our reliance on congregate care for serving foster youth. And it is consistent very much so with the objectives of continuing care reform, which was implemented through the passage of AB 403 along with subsequent legislation. And as we can understand is that California is already very much in compliance with FFPSA Part 4. And in order to achieve full compliance, Department of Finance in May 17th released the—
Alicia?
Yes.
I'm sorry, it's a little hard to hear you.
Oh. Okay, let me come a little closer. Is that a little bit better?
Yes, it sounds a little better. Thank you.
Okay, apologies. Okay, so again, as I previously said, California is very much already in compliance with FFPSA Part 4. And in order to achieve that full compliance, we did work with Department of Finance, and they did release the trailer bill originally in February, and then again, a second revision in May. The revision was very much based off of stakeholder engagement that had occurred over many weeks. And to review the trailer bill language, what we usually recommend is to do a walkthrough with the actual trailer bill, with the actual chart itself. The walkthrough chart actually goes through the different components in a way that's a little bit more absorbable for the actual trailer bill content. Okay, next slide.
Great, thank you, Alicia. So I just want to, before we jump into talking about the qualified individual piece of FFPSA Part 4, I just want to bring us back to thinking about our vision, as Peter talked about earlier in the presentation. Our vision that all children live in a permanent home with a committed adult who can meet their needs. And ideally, children and families are not coming into our systems because they're getting what they need without coming into foster care. So kind of hearkening back to our conversations that Kelly was leading around part 1, having a prevention-focused lens. When children and families are involved, the qualified individual or QI provision is particularly consistent with California's vision and really does further the goal that children and youth remain or are reunited with their families quickly. And also that youth, if they do require removal from their home of origin, that they are in the least restrictive placement setting that meets their needs, and that treatment and placement support permanency. So that's the real big picture that we're operating within. You may remember some of the early pain in implementing CCR. I know for some out there, CCR is a trauma trigger. There was a significant amount of system and practice change that really caused disruption in a positive way, in the way that our systems engage and interact and support children and families. And the good news is that all of that work with CCR is giving us a tremendous head start in implementing part 4. So I just want to talk quickly about these bullet points that are on the slide. So one, as a condition of 4E funding. So this is an entirely new construct that's now required in order for placement into an STRTP to be eligible for federal funding. There's now a requirement that the qualified individual conduct a comprehensive assessment, engage with the CFT in doing that, and then make a determination. There's also provision in our trailer bill language regarding emergency placements that we'll discuss a little later. The qualified individual is intended to be a trained professional or licensed clinician, and that's language directly from the federal law. The federal law goes on to create separation from the 4E agency, so the child welfare and juvenile probation departments, and create separation from any connection to any placement setting. So clearly the intent is to create a second opinion process in order to ensure that youth's needs and recommended clinical interventions are identified and really thoroughly considered as to whether those interventions can be provided in a family-based setting, and essentially ruling that out prior to a determination that a child or youth require an STRTP level of intervention. And I know that that may cause a little bit of heart palpitation, but we will get there. The QI, another thing I want to point out is that the QI, qualified individual, is distinct from and will collaborate with the Interagency Placement Committee. So the role of the QI is to assess the level of needs and mental health treatment goals, to consult and engage with the child and family team, and to make a determination which effectively rules out lower levels of family-based care. And the role of the Interagency Placement Committee is to support multi-agency system planning, making that medical necessity determination, confirming that the specific STRTP will meet the needs of the child, and also to support coordination of care. And in that, the child and family team definitely has responsibility as well. And then lastly on this slide, just want to talk about, in the case of the Indian child, that a tribe may designate an individual as the qualified individual who will engage with the tribe and CFT as part of the required assessment. Or if the tribe does not elect to designate, then the qualified individual would have specialized training and knowledge about ICWA and would still engage with the tribe and CFT as part of their assessment process. And then on the next slide, we'll talk a little bit more about really what the intent of this role is. and involvement in the CFT and those qualified individual activities. So the qualified individual has to determine and document a number of items, but the big picture, right, is really addressing that question of whether and how to meet the needs of the child and their caregiver, because this is in the context of, it's the child in the context of their family. So whether and how to meet the needs of the child and their caregiver in a family-based setting. And the qualified individual report then is essentially a clinical roadmap informed by the child and family team. And the way that we have designed it, and through all of the feedback that we've received, is to really integrate and leverage existing processes like the child and family team, utilizing the CANs as the assessment and communication information sharing tool, and building the QI utilizing intensive care coordination activities, which stem from KDA, for those of you who are familiar with that. So we really are trying to leverage what's already in place and integrate with that, not only to come into compliance with FFPSA, but to achieve our state's vision that children remain with and are connected to loving families and have permanency. So I mentioned that the qualified individual has a number of responsibilities, including engaging with the child and family team. That's one of the first things that they do. They are also reviewing existing assessments. If there's already been a CANS completed, the qualified individual can build from that in conducting their assessment. Let's see, they also, in the case of an emergency placement, so just wanted to talk quickly about that piece. So ideally, the qualified individual assessment and determination would happen prior to a youth being placed into an STRTP, right? I think we all would agree that placement moves are traumatic for a youth. And so we really want to make the best informed decision and have all of the interventions and supports made available to a youth and their family as quickly as possible, and avoid placement moves and placement disruption. In the case of an emergency, which we will be further defining, there is a provision that a youth can be placed into an STRTP so long as the IPC has given approval. But the QI assessment and determination still has to happen within 30 days of that placement. And again, this is a condition of 4E funding. And next slide. So we'll talk a bit about transition. So in thinking about transition, if a youth is ultimately placed into an STRTP, the focus really becomes providing the interventions that are recommended by the QI in that clinical roadmap. And the STRTP team, as outlined in the needs and services plan. So providing those interventions, and then concurrently planning for a transition to a family-based setting and for permanency. In some cases, youth may have barriers to permanency, which can be complex. Things like not having identified family or connections. And in that case, the caseworker and child and family team and qualified individual all have a role. The QI report, again, would include a recommendation to refer for specialized permanency services, something like intensive family search and relationship building. So the caseworker and child and family team would work together to confirm whether there's an identified family-based placement option for the youth to transition into, and if not, would make a referral for specialized permanency services. And then the last thing I wanted to talk about on this slide is actionizing the qualified individual recommendations. So the Child and Family team and IPC, and sometimes even the county interagency leadership team under AB 2083, each county has an interagency leadership team now, will all have a role in arranging for the interventions recommended by the QI. We know that without those recommended interventions, with a direct response to the youth's identified needs, that placement is really likely to disrupt. So if we know that there's a need and we don't meet it, it's likely that placement won't be stable. So the key is to really team and plan together about how those recommendations will be put into place. And ideally, that kind of teaming and planning happens, starting now, thinking about what that's going to look like as a collective group of systems, with, thinking about system of care and the partners who are also involved in serving and supporting children and families, coming up with a plan about how to actionize the qualified individual recommendations is really important and will help to make sure that we're not caught in situations where we have some great recommendations based on this really comprehensive assessment, and we don't have a way to actually actionize those recommendations. So we're going to talk and think more about that in the upcoming coffee and conversation session. So I'm going to take just a quick pause. We're going to move into talking about aftercare, but Stephanie just wanted to check and see if there were any questions that we wanted to address now, or if we want to wait until the end.
Sure. And actually, Lisa, we do have quite a bit of questions that came in about the qualified individual. So what we can do is try to cover some of them, because I know you still have some more slides to go over. And then, of course, if there's additional questions, it can most definitely be brought up in the coffee and conversation that will be taking place within the hour. So, we'll go ahead and we can go ahead and start now. We'll just maybe 5 minutes go over some of these. It says, the first one is, when will we know how to acquire the services of the QI?
And so I'm not sure if that question is asking, like, at what point would you make a referral? But assuming that that's the case, that's actually one of the things that we're going to talk about in the coffee and conversation session. We're all some additional stakeholder working group sessions to think about that together. What we want to do is try to make those referrals when we have concerns about placement stability. There are still requirements under placement preservation to hold a CFT meeting and try and do that teaming and collaboration to preserve a placement and make sure that all the needs have been identified and responded to. So we're trying to identify what are those indicators and markers that would lead to a referral to the QI. So I think that's something great for us to think together about, and we'll talk about that more in the upcoming session.
Thanks, Lisa. And then the other question that came in was, it's more of, it looks like some of them had came in about the same question about who is a qualified individual? Like, can you give examples of what that would be? Could it be the county behavioral health? So do you want to kind of briefly cover that?
Sure, yeah. So under FFPSA, I talked about earlier that the way that the federal law is written, the qualified individual can't be an employee of the state 4E agency, which in California, that means the Child Welfare Agency or the Juvenile Probation Department, because that's a delegated authority as a 4E agency. So can't be an employee of child welfare or juvenile probation. Also can't be an individual who's affiliated with or connected to any placement setting. So what it could be is through a behavioral health department. There are a number of intensive care coordinators who are already trained and have that clinical background. Those individuals could be qualified, could act as qualified individuals. And also wraparound providers who have the ability to provide specialty mental health services and bill to Medi-Cal. If they're not affiliated with a placement setting, qualified individual. I do just want to point out that the California Department of Social Services and the Department of Healthcare Services are really jointly working together to develop our policy guidance and give instruction about what exactly this will look like, who can be a qualified individual, what the requirements are, and the certification or approval process. And we're also developing training as well.
Okay, and one of the questions that kind of tie in, and forgive me if you've already stated that, it says, it is to my understanding that the federal legislation allows the opportunity for the state to submit a waiver for the definition of who the QI can be. Is the state planning to submit a waiver?
So that is correct, that there is the opportunity for a waiver. That's something that we've talked about, but at this point, we have not pursued.
Thanks. And then another question came in is, who has the ultimate decision authority if the IPC and the QI don't agree?
So ultimately, in terms of the federal funding piece that I've talked about a couple of times, the determination really is the qualified individual and then the court. So the IPC has a role in medical necessity and making sure that the specific STRTP is really got the service array that's responsive to the youth's identified needs. But the federal funding piece, as outlined in FFPSA Part 4, really is relying on the qualified individual and the court to make that finding.
So it sounds as though, just want to confirm, Lisa, the judge can override what the QI has, recommends, right?
So if the qualified individual says, yes, that a youth, it's determined that a youth's needs at this time can't be met in a family-based setting, the court may have additional information, and so they may find that no, that's not the case, and they are recommending a family-based setting instead. So that is a possibility. And I don't know if we happen to have anyone on from the Judicial Council who might be able to speak to that further. Okay, we may not at this time, but yeah, I think the key piece there is that this is an issue and it's a new requirement around federal funding, federal financial participation in making this kind of determination. And so it is, again, relying on the qualified individual and the court to make those determinations.
Thank Lisa. We actually, due to timing, there were some other questions that came in, and hopefully those that have submitted these questions, additional questions, will be joining us in the coffee and conversation, because we have to move forward to the next part of Part 4. But we most definitely, some of these questions are what we've commonly heard, but it would be great to cover that during the coffee and conversation. So go ahead, to my understanding, you wanted to present on aftercare. So you can go ahead and move forward with that. And hopefully if there's a little bit extra time, we can go back to the QIs.
Excellent. Okay. So then talking about aftercare, and Jillian, if you would, thank you. Thanks for advancing that slide. Aftercare in California. So another new requirement, another great opportunity to really stabilize children and their families after an STRTP intervention. So as of October 1st, 2021, counties, child welfare, probation, mental health plans will need to jointly provide or arrange for or ensure the provision of 6 months of aftercare services. In doing this, California has decided to utilize high fidelity wraparound as our aftercare model. And we looked to wraparound because it's effective. So going back to the reference to evidence-based practices, wraparound has a significant amount of evidence behind it that really show the teaming and collaboration and individualized persistence and voice of youth and families as really being impactful and making a difference in youth and families meeting their goals and achieving safety. 42 counties in California, and actually it might be more than that now, have wraparound programs. So we were looking to leverage the fact that we've got deep roots in California with wraparound and build from really what counties are already doing. And it's consistent with our system of care and integrated core practice model principles. So we saw this as an opportunity to strengthen wraparound by further defining what it means to have high fidelity and also to provide additional funding. So that's the why. The what is providing high fidelity wraparound for 6 months following the transition from an STRTP to a family-based setting. And this applies to youth and non-minor dependents. And we can move on to the next slide, please. So recognizing that counties and wraparound providers and programs and the work groups that we have established are all in different places and need time to implement the high fidelity wraparound standards. We have made available a phased in approach in the trailer bill, and we will also be providing further guidance that helps to articulate this. So counties will jointly submit an aftercare plan to CDSS and the Department of Healthcare Services by October 1st of this year that leverages existing wraparound programs and other resources. And the idea is to build capacity to provide high fidelity wraparound aftercare by October 1st of the following year. So October 1st of 2022. And then county systems would submit another plan as of October 1, 2022, documenting how the county is providing high fidelity wraparound with a certified wraparound program as of that date. And then annual plan updates are required from there. And then looking at the next slide, we have just a bit about the governor's budget. So the county must make aftercare services available for at least 6 months. Transition planning and relationship building is really important. And so there's also startup activities that can begin at least a month before the youth plans to transition to a family-based setting. And funding for those startup activities and aftercare services are in the CDSS and Department of Healthcare Services budgets. And we will be issuing claiming guidance for that. And then looking at the next slide, there are a number of opportunities for engagement to help inform and influence what high fidelity wraparound looks like and how we operationalize this in California. So encourage you to join any of these committees that you might have interest in. And then looking at the next slide, wanted to share just a number of deliverables that those wraparound work groups will be pursuing and completing over the next several months. So updating the California wraparound standards and ensuring that those are really concrete and actionable, providing contracting guidance and support, recommending wraparound program fiscal structures based on the requirements that we're going to be articulating. The financing for wraparound is so unique and interesting because it really does leverage multiple fund sources in order to really comprehensively and uniquely meet children and families' needs. And so, you know, with that complexity, we want to provide some additional support to make sure folks really have a deep understanding of how to make the most of wraparound. So guidance on and training support for leveraging funding streams across system of care partners, and standardized training and coaching and more, as you see on the slide. So lots of work, lots to be involved with if you are interested, and we'll provide some contact information a little later in the slide deck. And then I will turn this over to Alicia to talk a bit about the case plan documentation requirements.
Great, thank you, Lisa. Can everyone hear me a little bit better?
Yes.
Okay, great, thank you, Lisa. Okay, so according to section 16501.1, and again, this is in the trailer bill, that section does apply to children and non-minor dependents that have been placed into foster care by a county placing agency, and WIC 706 applies to minors placed in foster care by probation agencies. And then within 30 days of the child's placement into an STRTP, the documentation within the child's case plan has to include information that demonstrates the permanency planning that is inclusive of the child and family is occurring, information reflecting the child and family team's efforts, as well as the IPC and QI's determination and assessments. Next slide, please. And again, to speak on the court oversight and placements into an STRTP, FFPSA does require additional court oversight, which will include court hearings within 60 days of the start of each STRTP placement. And I do want to highlight that that does actually include placement changes as well. And so for each placement and or placement change, a new court hearing is required to approve the level of care based on the assessment by the qualified individual. And at each court hearing, the court of jurisdiction must take into consideration the QI's assessment when determining whether the STRTP is the most appropriate level of care. There has to be a review of placement at post-hearing status and probation status review hearings. These hearings do require the supplemental report or probation a social study that includes evidence of the following. These reports have to include the youth's strengths and needs, continues to support the determination the child's needs cannot be met within a family-based or home-based setting, that the placement continues to be the most effective, appropriate, and least restrictive setting, as well as the placement is consistent with the short and long-term mental and behavioral health goals, as well as the permanency goals for the child. And the Judicial Council of California has amended their rules in anticipation of the October 1 deadline. Next slide, please. If you do have any additional questions, part 1 questions can go to the very first line, which is FFPSA prevention services at dss.ca.gov. And then the part 4 questions can be sent to our group mailbox at FFPSA at dss.ca.gov.
Great, thank you, Alicia. We'll go ahead and cover, it looks like we have a little bit of time. There's some questions that came into the Q&A. I'm sorry, Lisa, I just noticed you pop up there. Did you have something else you wanted to chime in on before we begin with the Q&A?
Oh, no, I sure didn't.
Oh, okay. just from the last part of the presentation, there was a question about what's the difference between wrap services we have now compared to high fidelity wrap services?
Fantastic question. I will say over time, so wraparound has been in place in California for over 20 years. And we have wraparound standards in California that have also been in place for a very long time. But we really haven't had oversight and accountability structures in place to ensure that wraparound programs and providers are following those wraparound standards. We also haven't had funding. Well, I should clarify. There was funding that was realigned to counties, but over time, you know, there have just been a number of changes, and the funding, you know, it's been up to the counties to determine how to really structure those contracts, how to decide whether there is shared funding with behavioral health or leveraged funding, how maybe the Mental Health Services Act, MHSA funding is utilized. And then just a number of other areas like ensuring that there are peer partners, parent partners engaged, that wraparound is really embodying that do whatever it takes 24/7 type of approach. And so this is an opportunity for us to come back to those roots, really take stock of what the wraparound standards intended, and have the opportunity to have some accountability and some additional support in terms of funding and technical assistance, training and coaching, to make sure, kind of like Peter talked about, that in an evidence-based program that we are really administering it in the way that it was intended so that we achieve the intended outcomes. Right. And so I think over time in California, there has been some drift. And so this is our opportunity to really come back to our roots.
Thanks, Lisa. There was another question that came in about, let's see, aftercare. So it mentioned, if I'm reading this correctly, 6 months of aftercare is being mandated. So it seems probation is being mandated for an additional 6 months. How does this fit with removing the delinquency stigma as soon as the minor has achieved treatment goals?
Yeah, that's a great question. And I'd love to think further with you all about that. So I'll just say a couple things about it. Aftercare is intended to be a stabilizing, supportive kind of service that is ensuring after a youth is stepping out of an STRTP, which, you know, in the way that we're designing this, youth who are going into STRTPs have a very high level and complex level of need. And so then to step down into a family-based setting, it would be hard to imagine that you can go from that really high level of intensity and supervision into a home-based setting and no longer need any of that, right? So the design here is to make sure that we are really wrapping around the child and family and providing that kind of transition and warm handoff, skill building, support networks that just kind of makes sense. I hear you in terms of not wanting to prolong system involvement and particularly a stigma with delinquency. And so I think conversations with the child and family team about how best to provide those services and mitigate any of those you know, unintended consequences of trying to support the family are really important. Would love to think more about this together with you all and make sure that we shape our guidance in a way that makes sense.
Thanks. Another question came in. It says, for aftercare, that is to start 1 month prior to transition out of the STRTP, will funding be for a total of 7 months to cover the 6 months post-exit from STRTP? Or does the 1 month start prior to transition count towards the 6 months?
That's a great question. So the 1 month while the child is still in an STRTP does not count towards the 6 months after. The 1 month of like transition support services while the child is placed is really to start that relationship building, make sure that the wraparound team is engaged and connected, making sure to do that preparation work with the family and the identified caregivers and the youth, so that it's a soft transition, not a hard transition. So those are separate periods of time that are funded.
Great. And then we'll probably have one more, try to go over one more question. We'll see how it goes with timing because we have about 5 minutes left. It says, there has been very little or any mention of equity or decreasing disproportionality. How does the state and county see Families First as a tool to address the inequities? Our BIPOC, I don't know how to pronounce it, BIPOC, is the acronym, Children and Families Experience. So I can repeat that question. There has been a very little or any mention of equity or decreasing disproportionality. How does the state and county see Families First as a tool to address the inequities our BIPOC, Children and Families Experience?
Lisa, I can field that question if that's helpful.
Great.
So in part 1 of the prevention of FFPSA, in our prevention services plan that was released in March, we spent a lot of time talking about the intention to reduce disproportionality of BIPOC. So really, we focused very specifically on our population of families who are Black, and then also our Native American families. Because when you look at the data in our system, those are the folks who are most overrepresented in our foster care population. So if you take a look at the March draft, we do cover a lot of information about that. And I think in the stakeholder meetings that we had, the feedback we got was that was great, and we really want to focus on those communities, but we didn't do a great job of, or maybe as good as we wanted to, of connecting the approach and services in the plan. And so that's something that we've spent a fair amount of time over the last several weeks and really thinking through what that could look like. And I think it's going to take time because we're limited by the number of EVPs that are available in the clearinghouse. But we also heard a lot from tribes around, really making sure that larger prevention vision is, packaged in such a way so that if there are programs that don't quite meet the evidence-based standards, that we're using other funding sources to help support the availability of those for those communities. And then really thinking through what programs are best and most of interest to those communities, and trying to support and lift up funding to meet the needs of those populations and make those available from a state funding perspective. So, so more to come on that, but just know that there's absolute interest and intention to really focus on that. And I think when we get to the point of implementation, we can really talk with folks about, is our approach the right one? How do we better that at the local level and support you all in ensuring that you have the continuum of services and the infrastructure available to help them meet the needs of those populations. So just wanted to point that out from a prevention services perspective.
Thank you, Kelly.
Thanks, Kelly. Well, I'll go ahead and pass it over to Chief Branning. She'll be doing closing.
On behalf of the Chief Probation Officers of California, I want to thank our speakers today for their time in presenting to us, as it is busy preparing for implementation. I also want to thank our attendees for joining us for this valuable information. To hear more about the Families First Prevention Services Act, we will be having an informational session on part 4 today at 11, and part 1 will be held tomorrow morning. Also, we have concurrent sessions being held this afternoon at 1:30. One session will be presented by the Los Angeles and Calaveras County Probation Departments. They will cover strategies to help prevent out-of-home placements. The other session is about the Indian Child Welfare Act that will be presented by the California Tribal Families Coalition. ICWA was passed to protect the best interests of Indian children and promote the stability of Indian tribes and families. As a friendly reminder, at the end of the conference, you will also receive an email with the evaluation link. Please be sure to complete that so we can design our conference to your needs. Again, thank you everyone, and enjoy the rest of your conference.